why I'm a hard no on colonoscopies, and what I do instead.
A lot of weird statements about colonoscopies, so let's go over the claims.
They infiltrate your colon, scrape the walls, and introduce bacteria that isn't supposed to be there through micro tears, creating a poop storm.
I don't think she knows how a colonoscopy works. They take a scope, stick it from behind, and visually look at the walls of your colon. They're not scraping or cutting or anything like that unless they see things like polyps or cancerous lesions that they can remove right then and there and look under a microscope and see, is this dangerous and do you need colonoscopies more often? This is active, not just diagnosis, but treatment.
Like you're drinking a toxic prep solution that wipes your entire gut flora. That's your immune system. Poof, gone.
The drink she is referencing is called Bowel Prep. One of the most popular ones that is currently used is a brand called Go Lightly. It is a, unfortunately, very large drink that helps people poop out everything that's in their colon so that when you're having a colonoscopy, it's easy to see so nothing gets missed. But let's say all of that was true. Let's look at the actual benefit of a colonoscopy, as seen by this expert review. They reference the Nordic study, which was a randomly controlled trial looking at the benefits of a colonoscopy. Although the people that were invited for a colonoscopy was lower than expected, the risk of obtaining colorectal cancer dropped by almost 20%, and the risk of dying of colorectal cancer dropped by relatively 50% if you got a colonoscopy during the screening times that you were supposed to.
For what? To find something that took decades to develop while doing nothing to address why it developed in the first place? Duh.
I feel her last sentence is a little insensitive, especially with the rising incidence of colorectal cancer in the younger population. We already know a lot of modifiable risk factors that can affect your chance of getting colorectal cancer, including diabetes, metabolic syndrome, smoking, alcohol use, but are things that people can't control, just like being a man or having genetics work against you. Sometimes it is not the patient's fault. So to go online and recommend against colonoscopy screening, that in itself is irresponsible. Don't get scammed. Take back your health.